Are you curious about breast cancer, like what it is, what causes it, and how to prevent it? If you are, please stay with me. If you find this video useful, kindly like this video, share and subscribe. People wonder why people talk about breast cancer a lot. This is because it is very, very important. It is the most common cancer in women. Alarming, right? I know. So, let's start by defining what cancer is. Cancer is a disease that is caused by abnormal cell growth. For example, in the breasts, I just want to illustrate, in the breasts, if we need like 5 to 15 cells in a normal human, and we find about 120 in another person, that is cancer. So breast cancer is cancer that is found in the breast tissue. Types of breast cancer. I would want to leave this one for professionals because this is kind of technical. But the most common is ductal, which starts from the ducts in the breast. The ducts are the ones that transport milk from the glands where they are produced to the nipple. Signs and symptoms. The most common presentation of breast cancer is painless lump in the breast. Pain in the breast in breast cancer is a sign of late disease, and this has a bad or poor prognosis. Other presentations include pain, like I said, wrinkling of the skin over the breasts, swelling of the breasts or part of the breasts, nipple retraction, redness of the breasts, and so on. These signs and symptoms actually differ from person to person. Risk factors. These are factors that increases your chance of having a disease. These are potentially the causes of a disease, but not necessarily. That you have these factors, one or two or more, one or more, doesn't mean you have the disease. It just increases your risk of having the disease. Number one is being born a woman. Women have more risk, more potentials of getting breast cancer. But surprisingly, breast cancer is more aggressive in males. Age. Breast cancer is more common in women from 35 years and older. Age at first pregnancy. The older you are at first pregnancy, the more likely you're going to develop breast cancer. If you have never given birth, never breastfed, you have an increased risk of developing breast cancer. Genes. There are genes that are passed from generation to generations in families, and these increases the chances of developing breast cancer. Example is the BRCA gene, BRCA1 and BRCA2. I don't know if you've heard the story of Angelina Jolie that has her breasts cut off. It's because it was found that she has these genes, and so she decided to cut off her breasts before she even develops breast cancer. Parity. The more number of children you have, the less you are likely to develop breast cancer. Oral contraceptives. Oral contraceptives, these are birth control pills. The more you expose yourself to birth control pills, the more you are at risk of developing breast cancer. Chest radiation. People exposed to chest radiation, especially in lung diseases, have higher risk of developing breast cancer. For early detection, the responsibility is on you. That means you're going to have to pick it first before you approach your health worker. Once you see or feel any abnormal thing in your breast or on your breasts, do not hesitate to meet a doctor. Treatment. Treatment depends on the stage of the cancer. It could involve use of drugs, surgery or radiation. For surgery, it could be lumpectomy, which involves the removal of the lump, or mastectomy, which involves the removal of the breasts, the whole breast, or both. For drugs, which is chemotherapy, we use drugs that kill the cancer cells. It is this chemotherapy that causes people to lose their hair in cancer. For radiation treatment, also known as radiotherapy, rays are used to kill the cancer cells. The problem with this particular treatment is that it further exposes you to other cancers. Survival rate in breast cancer. Survival rate is quite high, actually very high, when there is early detection. So the emphasis is always on early detection. As soon as you notice any change in or on your breasts, do not hesitate to meet a doctor. Also, survival rates could be dependent on the type of cancer, but the only one we can control is early detection. Prevention. There are risk factors that are beyond our control, like our gender and our age. We cannot do anything about them. So, the emphasis here is on factors that we can control, like adopting a healthy lifestyle, working out, eating properly, stop smoking, reduce your alcohol consumption, reduce or even stop the consumption of oral contraceptives. In conclusion, the emphasis in breast cancer is on early detection. Please and please touch your breasts, massage your breasts so that you can know when there's anything abnormal on or in it. Thank you guys for watching.